I've got to tell you, I'm very pleased with the efforts, the combined efforts of the team that I have inside the governor's office, working effectively with Stan Hefner, the superintendent of education. And we are coming with a number of proposals here that we think will help parents to understand things in a clear way, and also make sure we're standing up for our kids. We're going to change the current system that we have to a letter grade operation, which Dick Ross, a great former superintendent of Reynoldsburg, will describe in detail. But we want parents to understand exactly how their schools are doing, and at the same time we intend to raise the standards. Our standards have not been high, and our results are not doing for being able to allow children to have the kind of progress that they need in order to be successful throughout a lifetime of employment. And we intend to raise the bar, to have a tougher curriculum, to demand more, but at the same time to make sure that we're able to encapsulate those things that we learn at places like the Wells Academy, which is more dollars in the classroom, surrounding children, having accountability for teachers, accountability for children, so that we can know how they're doing. We're going back to this. I just read somewhere, somebody sent me a story somewhere, that we have this third grade reading requirement that somehow got dismissed. I don't understand that. We don't believe in social promotion, but we also don't believe in throwing a switch on somebody at the last minute to say you can't read. But we're going to start all the way in kindergarten, the first grade, the second grade, up through the third grade, to surround our kids who have questions and issues about reading. But if they can't read at the third grade level, we're not going to move them to the fourth grade. That is doing the children a disservice, doing the parents a disservice, and we think we can do this in a very positive way, and we think it makes a lot of sense. We also are going to weave into the basic curriculum the idea of career connections. We want kids thinking at an early age that when somebody asks them what they want to be, it shouldn't always be, I want to play in the NBA, or I want to be a baseball player or a professional golfer. We want kids to say, I want to be a mathematician, I want to be a geologist, as one of my daughters says, I want to be a neonatologist. I keep having to explain to me what that means, but that's a joke. But the point is, the point of the matter is, we want kids thinking at an early age about what their skills are, what their passions are, and how they can realize them. And the superintendent, working with the staff inside the governor's office, come up with, we think, a very good program to be able to have that happen. We also have talked a lot about workforce development. We are now going to codify the way in which we're going to create a workforce development board inside the governor's office. And I have to tell you, the issue of workforce development is so critical. We are now asking in our regions across the state for trade associations and chambers of commerce and small business communities and big-time business honchos and K through 12 and technical schools and community colleges and four-year schools to work region by region, to ask businesses to talk about the skills that are going to be needed in those communities over the course of the next few years, so we can begin to train our kids and our students for those jobs that exist out there. If we can break through and solve this, in my opinion, it will not only help solve the problem that employers have today with a mismatch of skills and needs, but I think at the same time it will also help us to improve K through 12 education by being able to have our schools begin to bring real curriculum based on real needs to our students in, I think, a new and exciting way. Mayor Jackson's plan for Cleveland. Not ready yet. We have asked the mayor, we've been working, I guess it's now 5 weeks since I had a meeting with the mayor in my office. We've asked him to go out and deliver some bipartisan support for this program. I believe this program is critical to Cleveland. I give lots of credit to the mayor for the leadership he's providing, but it's not done yet. It's not ready yet, and I'm hopeful over the next few days, next few hours, next few weeks, I don't know, that we're going to be able to be delivered a bipartisan program to support this. I have renewed my request to the mayor that go door to door. I'll stand outside the door, I'll go in the door, whatever you want. I think this is an opportunity to get to Cleveland schools moving in the right direction, and my fear is if they fail on this, frankly because of politics, the business community in Cleveland has indicated to me they're walking away. No more support for levies, no more support inside there. It'd be devastating. That's why I hold out hope. In fact, the church on Sunday even asked the congregation to pray that people would have courage to move this Cleveland School plan forward. It will not be in this bill, but we're ready to move it as soon as we can. It will be the Jackson bill, and I will do everything I can to help him to pass that. We will also have in this bill a number of management improvements for government, combining programs in the state that should have been combined a long time ago. Tim will get into some of that, and also continued work on Medicaid. And just a word on Medicaid. It is as I try to tell in fact, I told the administration, I told Jack Lew, and Greg, I don't think I even told you, I said that I think what we have done on Medicaid has been some of the most creative work that you can find in the country. First of all, of course, allowing moms and dads to be in a setting where they can get more independent care by being at home, integrating mental health and physical health, creating medical homes so that people have coordinated care, and now working with private companies to be able to leapfrog with them to drive outcome-based medicine. But medicine in America and in Ohio has been largely driven by quantity, not by quality. Reimbursements are based largely on quantity and not on the product that's produced. We absolutely need to get into quality medicine. We need to work with the private sector companies in this state to make sure that no one is left behind, that people can get care that makes sense to them, it's rational, it produces good results. And Greg Moody has done a terrific job, and he comes forward with additional reforms, including a much greater use of electronic records, which, if we're not careful, we're going to enter the 21st century here, both in job creation and also in healthcare. So I think Scott, anything I missed? I think that's a good start, and let me turn this over to the